Now, Minister-designate for Gender, Children and Social Protection, Sarah Adrasafo, is pledging to rebrand witches' camps located mainly in northern Ghana to help fight the menace of women being held in bondage in so-called camps accused of witchcraft. The issue of witches' camps is one that has been extensively covered by Joy News. In this report, we first broadcast in 2020, for example, we highlight the difficulty in integrating these alleged witches. The Ghana Health Service, in the latest data capturing event on the 13th of February 2021, has recorded 6 more deaths, pushing COVID-19 deaths to 561. The country's active cases is now 7,866. There are 89 people who the service says are suffering severe COVID-19 symptoms, with 26 people said to be in a critical state. We have Dr. Michael Owusu, who is a virologist from KCCR, joining me right now on Zoom. Doc, thank you for your time this evening. Looking at the figures, what options will you recommend as the way forward as far as our fight against COVID-19 is concerned?
Yeah, good evening to you and good evening to your viewers. I mean, the numbers are quite scary, looking at especially the deaths, which almost every day we seem to be having some additions, and it looks as if cumulative death in January and February almost getting to around 200. So if we look at the pattern of the virus, the number of new cases we are getting seem to suggest that the virus is rapidly infecting and expanding in what we call the log phase order of transmission. Ideally, at this phase, we should expect some higher levels of restrictions that will allow for reduction, for movement, I mean, slowing in movement in the way people go by their thing. So the president did announce some restrictions in the last address, and I was expecting that it will yield some net positive impact in terms of reduction in these new numbers and deaths. But if we still have these on the rise, then it means that we still have to consider the other options on the table that was mentioned by the president, and possibly trigger some additional restrictions to ease movement. I mean, the virus moves when people move. So if you have a spread of the virus across and deaths increasing, it tells us that people are moving and they may not be adhering and they may not be doing the right thing. And we need some higher form of restrictions to enable us to be able to...
If you just take a look at the numbers, you realize that the active cases have actually gone down based on what we had in the past few weeks. But the number of people who are dying has actually gone up. Shouldn't we begin to fix our attention away from, rather what is happening, post-COVID symptoms, whatever it is that is killing people, rather than, discussing restrictions at this point?
Well, you know that the number of new cases correlates with the active case counts, and this in turn correlates with deaths. Okay. So you cannot separate these three. So as far as you get new cases coming in, your active case count is going to increase. And if that increases, you are going to have deaths. Okay. So if you want to solve active case count problems, then you want to solve transmission problems. And if you're able to cut transmission chains, then you have the chance of reducing hospitalization and therefore death. So the question is, as more people become infected, then of course more people develop complications, even if they recover. So how do we break the transmission in order to reduce spread of this virus? I think this is where the conversation has to be. And I think that we as a people need to do well. We have to ensure that we mask up and do everything that we need to do. But once again, if we are not adhering and people are not doing what is right, then of course some other measures.
And so I get the sense that you are asking for more restrictions, but considering the country's economy, does it appear to you as though government has actually the appetite to tighten the restrictions which already exist?
Well, I think government has a number of advisors who look at various aspects of the economy to see what can be done and what cannot be done. Okay. I don't think lockdown is where we have to go to. I wouldn't support that because it has not worked for us. But it is possible to look at many other ways. Markets, transport networks have a grading of the schools to determine thresholds that will cause you to close down schools when possible. have a look at hotspots where people may not adhere to protocols, maybe in the night, and see how you can impose some marginal levels of curfew. To do something that at least will yield some impact. So I think government has all these other advisors on board that it should be able to move ahead with something if we really want.
But then the state generally has a major challenge when it comes to enforcement of these restrictions. Of what use will it be if, say, these restrictions you talk about are imposed and we are unable to to enforce them?
Well, this will be part of government strategy. I mean, when you roll out a new plan and you know enforcement is an area that has not worked well, you want to step up include some other, whether to use the police, whether to use some other external security forces. And we've done this before. During the lockdown period, if you're in your car, you are arrested. So I think that the security also will have to look at the chains of the activity and to see how they can strengthen this. And I think that, as you have said, if the deaths are increasing, then what we ask ourselves is what is going wrong? People are not adhering, and other people who are adhering may be put at risk. So I think that we should begin to open up options, and not to also say that we are happy that vaccines are coming. So it's also hoping that when these vaccines come and they are administered to the hospitals, we may succeed in reducing the transmission and getting things well for us.
Dr. Michael Owusu there. Thank you so much, Doc. He's a virologist at the Kumasi Center for Collaborative Research in Tropical Diseases.